Hello everyone, welcome back to the lecture series Overview and Integration of Cellular Metabolism. So, we are in the discussions of amino acid metabolisms. Today we are going to discuss metabolism of tyrosine. Now, in this class we will discuss a brief of tyrosine, what are the characteristics of this amino acid, what are the metabolic fate of tyrosine, metabolic roles, different metabolic roles of tyrosine, and there are different specialized products which are formed from tyrosine, those metabolites, what are their importance, how they are formed, and finally, the different disorders related to tyrosine metabolism. So, let us move on to the basic briefs of the amino acid tyrosine. Now, as you have already gone through the phenylalanine. So, if you remember, this is the structure of phenylalanine. So, here we are having a benzene group. Now, in this benzene group, there is additional hydroxyl group added at the para position of this benzene ring. So, phenylalanine when hydroxylated at the para position, it forms tyrosine. So, if you remember from your previous classes of phenylalanine metabolism, you remember phenylalanine is actually forming tyrosine by a hydroxylation. So, this is the hydroxyl group added to form tyrosine. Now, about tyrosine, tyrosine is one of the aromatic amino acids and also a non-essential amino acid because it can be synthesized from phenylalanine. So, it is not essential amino acids. Then the degradation of tyrosine occurs in liver. The end products of the degradation is fumarate and acetoacetate. So, you can see tyrosine can be both glucogenic as well as ketogenic. Glucogenic why? Because it forms fumarate, fumarate can enter the TCA cycle. Ketogenic why? Because it forms acetoacetate, acetoacetate is a ketone body. Now, phenylalanine as also basically is degraded or rather catabolized via forming tyrosine, which when catabolized is actually the complete catabolism of both phenylalanine and tyrosine. Now, there are different biologically important compounds or metabolites rather, which are formed from tyrosine, like different catecholamines. Catecholamines are epinephrine, norepinephrine, dopamine, which acts as a neurotransmitter, hormones, thyroid hormones, then also a pigment, melanin. These are the important metabolites of tyrosine. We are going to discuss about them. So, if you remember this pathway, so this is the formation of tyrosine from phenylalanine, and the further this pathway if proceeds further, we will see how tyrosine is catabolized. So, you remember that from phenylalanine tyrosine is formed via hydroxylation. The enzyme is phenylalanine hydroxylase, and which is a biopterin dependent enzyme. So, you remember this, that tetrahydrobiopterin is forming dihydrobiopterin, whereas phenylalanine hydroxylase by hydroxylation forms tyrosine. Now, this tyrosine undergoes transamination with the enzyme tyrosine aminotransferase or transaminase. Now, like all the transaminases in our body, this transaminase, tyrosine transaminase is also pyridoxal phosphate dependent enzyme and can be induced by steroids. So, this path is induced by steroid. Now, because it is a transamination reaction, what happens? You can see this amine group is basically transferred to alpha ketoglutarate and glutamate is formed. Now, this step if inhibited why? If there is tyrosine transaminase deficiency, that causes tyrosinemia type 2. Then, so after transamination what we are getting is para-hydroxyphenyl pyruvate. Now, this para-hydroxyphenyl pyruvate forms homogenticate with the enzyme para-hydroxyphenyl pyruvate dioxygenase. Now, dioxygenase or oxidase is a copper containing enzyme. So, the cofactor is copper here. Now, you can see there is decarboxylation. So, basically this is a type of oxidative decarboxylation as well as hydroxylation which is occurring in the phenyl ring. So, here you can see previously there was one hydroxyl group, now here are two hydroxyl group added, and in this step vitamin C as well as B12 they act as cofactor. Now, when this dioxygenase enzyme is absent or defective, it causes another type of tyrosinemia type 3. Then from homogenticate there is formation of mallyl acetoacetate. Now, you can see till homogenticate there is benzene ring, but after this step that ring is opened. So, this step is important because there is cleavage of the aromatic benzene ring, and the enzyme here is another dioxygenase homogenticate 1,2 dioxygenase, and this is one iron containing protein, iron metalloprotein. And here to open up this aromatic ring, what is utilized? Molecular oxygen. For this step, the specific inhibitor which inhibits the dioxygenase enzyme is dipyridine. Dipyridine inhibits dioxygenase or homogenticate oxidase enzyme. Remember, this enzyme also known as homogenticate oxidase. And when there is homogenticate oxidase deficiency, there is a specific disorder which is known as alkaptonuria. Fine. We will be discussing these diseases later in this class. Then mallyl acetoacetate undergoes isomerization forming fumaryl acetoacetate with the help of one isomerase enzyme. Then fumaryl acetoacetate finally undergoes hydrolysis via fumaryl acetoacetate hydrolase or acetoacetate, fumaryl acetoacetate. So, it generates the glucogenic part fumarate and the ketogenic part acetoacetate, and this acetoacetate with the ketoacyl coenzyme A transferase can form acetoacetyl coenzyme A, where succinyl coenzyme A is the coenzyme group donor and it forms succinate after donating the coenzyme group. So, the fate is formation of fumarate which is glucogenic and also acetoacetate which is ketogenic. So, this is the complete catabolic pathway of both phenylalanine as well as tyrosine, where phenylalanine via phenylalanine hydroxylase forms tyrosine. Then this tyrosine undergoes transamination via transaminase to form para-hydroxyphenyl pyruvate. Then para-hydroxyphenyl pyruvate form homogenticate oxidase, homogenticate with the enzyme homogenticate with the help of the enzyme dioxygenase. Then homogenticate forms mallyl acetoacetate with the help of the enzyme dioxygenase, which is also known as homogenticate oxidase. Then mallyl acetoacetate undergoes isomerization to form fumaryl acetoacetate, and finally fumaryl acetoacetate is cleaved or rather hydrolyzed to form fumarate and acetoacetate. Fine. So, remember once again which one is the ring opening reaction here or cleavage of aromatic ring. Remember, formation of mallyl acetoacetate from homogenticate is the cleavage of aromatic ring. Aromatic benzene ring is basically open to the linear structure. So, let us discuss about the different disorders of tyrosine metabolism. So, we have already told there is tyrosine type 1 when there is enzyme deficiency fumaryl acetoacetate. So, this is basically the last enzyme. Remember, from fumaryl acetoacetate via hydrolysis there is formation of fumarate and acetoacetate. When this enzyme is deficient, the hydrolase or fumaryl acetoacetate, when this is deficient, it causes the type 1 tyrosinemia. Now, remember, when the tyrosine degradation pathway is hampered at any stage, what is the fate? There is accumulation of tyrosine. So, these group of disorders are known as tyrosinemia, and now at which level the inhibition is, based on that the names are given type 1, type 2 like that. So, the type 1 is the last reaction. Remember, type 1, the first type of tyrosinemia is basically the last reaction of its catabolism. Now, remember, all these tyrosinemias are basically inborn error of metabolism. So, these are basically genetic defects where the enzymes are somehow defective due to different types of mutation or complete absence or partial absence of the enzyme. Now, though these disorders are rare, type 1 is the commonest of all types of tyrosinemia. Now, what happens? What is the manifestation? Basically, manifestation can be either acute or chronic. Now, in case of acute manifestation, there is hepatic and renal failure which finally leads to very early death within around 1 year, whereas in chronic manifestation there is diarrhea, vomiting, cabbage like odor. This cabbage like odor coming from the body because of production of different types of organic acids like phenyl lactate, phenyl acetate like that, because remember tyrosine is accumulated. Similarly, in the back reaction phenylalanine will also be accumulated, and just like phenyl ketonuria, those accumulated phenylalanine can form other keto acids. So, those organic acids accumulation gives a cabbage like odor. Now, also there is vitamin D resistant rickets. Now, why there is vitamin D resistant rickets? Because the renal tubules are affected, and that is when the renal function is affected, remember phosphate excretion is affected. So, this vitamin D is basically because of hypophosphatemic rickets, and when treated with vitamin D, they these type of rickets do not resolve. So, that is why it is called vitamin D resistant rickets, which is manifested in tyrosinemia type 1. Now, apart from that, you remember the enzyme delta ALA synthase which is required for heme synthesis. This enzyme is delta ALA dehydratase enzyme is the enzyme is delta ALA dehydratase. So, delta ALA dehydratase enzyme is basically inhibited in tyrosinemia type 1. Now, what happens? Fumaryl acetoacetate, it forms succinyl acetoacetate. So, you can see fumaryl acetoacetate as well as mallyl acetoacetate, they form succinyl acetate. Now, succinyl acetate forms the lactone, succinyl lactone. Now, the succinyl lactone is one inhibitor of the delta ALA dehydratase. So, finally, delta amino levulinic acid is accumulated and heme synthesis is hampered in tyrosinemia type 1. Now, how this can be diagnosed? Succinyl lactone is accumulated. So, this accumulation of succinyl lactone is a diagnostic metabolite rather for tyrosinemia type 1. Then tyrosine level is either very slightly elevated or sometimes remain normal, because it is bypassed to some other products. Then there is methionine level which is also high, delta aminolevulinic acid is high, alpha fetoprotein level is also high. As I told, there is liver failure. So, this alpha fetoprotein is a marker of hepatocellular carcinoma. So, this alpha fetoprotein level is also high in tyrosinemia type 1. Then we are coming to tyrosinemia type 2. Now, remember type 1 is the last reaction, whereas type 2 is the first reaction where tyrosine is transamination is there. So, that enzyme transaminase or aminotransferase, when inhibited, it causes tyrosinemia type 2. Now, this disease is also known as oculocutaneous tyrosinemia, also Rickner-Hanhart syndrome. So, remember tyrosinemia type 2, the other names are oculocutaneous tyrosinemia or Rickner-Hanhart syndrome. So, once again the tyrosine degradation pathway is hampered, accumulation of tyrosine is there, that is why it is tyrosinemia. Now, this disease is specifically characterized by some skin lesions like hyperkeratosis of palm, soles, eye lesions in eye, there is painful corneal lesions in eye, mental retardation. These are the manifestation of tyrosinemia type 2. You can see there is, so these are the hyperkeratosis, see, thickening of skin, also corneal lesions, you can see the corneal lesions are there. So, these are the manifestation of tyrosinemia type 2. Then we are moving on to tyrosinemia type 3, where the dioxygenase is absent. So, homogentisate cannot be formed from para-hydroxyphenyl pyruvate. Now, because this enzyme is dependent on vitamin C, it is sometimes responsive to vitamin C treatment or ascorbic acid. Vitamin C is known as ascorbic acid as well. Then we are coming to one very important disease, alkaptonuria. Now, alkaptonuria, remember the enzyme is homogentisate oxidase deficiency, or that enzyme is also known as homogentisate 1,2-dioxygenase. The common is homogentisate oxidase. So, basically homogentisate cannot be degraded. Now, it was first described by Leucippus, autosomal recessive disorder, 1 in 25,000 births it is detected. Now, what happens? Because there is homogentisate accumulation, it is accumulated in different tissues, levels are very high in blood and also excreted in urine. Now, what happens? The commonest manifestation is that urine is becoming black if it is kept for long time. So, because you know this is one inborn disease, babies are affected. So, the commonest complaint from the mothers come that the diaper or the inner garments are they are colored black, because when they are stained with urine, those urine are turning to black or coke in color. So, you can see this urine, while it is kept for long time, it has turned to black, because homogentisate. Why this blackening? Because homogentisate, it cannot be degraded, it is accumulated and it is diverted to some other pathway. What that pathway is? It forms different types of quinones. So, here you can see benzoquinone acetate is formed by a polyphenol oxidase, and these benzoquinone acetates undergoes oxidations and form compounds which gives a blackish or brownish color. Now, via chromatography, the presence of homogentisate in urine can be detected. It can be detected in blood as well. For the clinical manifestation, Remember, alkaptonuria, if detected at early stage, it remains mostly benign, it is not a fatal condition, but on long standing condition for long time, what happens, this quinone derivatives, benzoquinone acetates, they undergo polymerization to form a pigment which known as alkaptone bodies, and these alkaptone bodies are accumulated in different tissues, connective tissues, bones, different organs, and forms, and the condition is known as ochronosis. So, you can see this is the vertebral column, and here these blackish stains are basically ochronosis or accumulation of alkaptone body. Also, this can be accumulated in different types of joints as well, causing arthritis. The treatment is just the phenylalanine restricted diet, give low phenylalanine to control its catabolism and formation of homogenticate. So, here you can see this is ochronosis, this is also ochronosis, and also the urine color is converted to black. So, these are all for our today's session. So, what we have learned is about a brief discussion of tyrosine, where tyrosine is glucogenic as well as ketogenic, because on catabolism tyrosine forms tyrosine forms fumarate, which is glucogenic, then also forms acetoacetate, which is ketogenic. Then different tyrosinemias, type 1, type 2 and type 3 tyrosinemias we have discussed, where there is inborn defects in the degradation related enzymes of tyrosine. Then we discussed about alkaptonuria related to the defective homogenticate enzyme causing accumulation of homogenticate, which is finally forming alkaptone bodies, also known as black urine disease, and also we have discussed the diagnosis and basic therapeutics of alkaptonuria. So, these are all for today. These are my references. Thank you and see you in the next class.